Hello and welcome. I'm Al Branca. You know, when researching any company, the best view is always from the top down because an organization is defined by its leadership. Well, we can't get any closer to the top today because with me as my guest is founder and CEO, Jerry Ferro. How are you, Jerry?
Doing good, Al. How are you?
Very good. Appreciate your time today, making time for us.
Not a problem.
Jerry, for the benefit of our newer agents just coming on board and learning more about the company and our products, can you do me a favor and give us just a brief overview of your history in healthcare, as well as the reasons that really made you move to this other side of the spectrum, and now we're in the space of healthcare discount plans?
Sure, Al. I had a health insurance company I'd sold to a joint venture between Blue Cross and Blue Shield and Atlantic City Medical Center, and I had a 5-year hiatus. I'd worked with the Department of Labor arm of the FBI uncovering fraud. And when my non-compete was up, one of my former large clients said, "Can you take a look at our pharmacy? It's become a runaway train." Well, in large employer, pharmacy and dental used to trend very close. So if you're spending $1 million on dental, you're spending $1.3 million on pharmacy. I came back in and there was such a disparity that I said, there's something evil going on in here and I've got to get to the bottom of it. So we developed a very sophisticated auditing system that started auditing pharmacy transactions from the large pharmacy benefit managers. And I realized very quickly I was in the largest game of 3-card Monte I'd ever seen in healthcare. The pharmacy benefit managers had created a model that was all theft by deception, all non-disclosed revenue sources that last year totaled some number in excess of $22 per transaction. And I thought, after auditing hundreds of plans, some of which you read about in the paper, we did an audit for the state of New York, $1.5 billion drug spend, $450 million in fraud and abuse. We realized that there was a solution that was needed in the marketplace, and that's when I created SunRx. SunRx really turned the market upside down because we're transparent, meaning that what you see is what you get. We charge a disclosed administrative fee, a modest disclosed administrative fee, for processing a transaction and giving all the benefit of the discount back to the consumer. SunRx was a very successful model. We went 0 to 54 million in 4 years. Number 5 on the Inc. 500 list. The economy had soured, and I saw an opportunity, a niche opportunity, to move in to help the millions of people that were losing their benefits along with their jobs, with GM and GE and Enron and Bernie Madoff, and you know the collapse of the financial markets as we know it. With that said, we wanted to take a product that really was designed for the uninsured, to make it available not only for the uninsured, but also for the insureds that were paying more than the cash price for their medications because of these problems with the pharmacy benefit managers. I take 1,500 milligrams ibuprofen. If I use my current medical provider card, it's going to cost me 15. If I throw that card over and say, I'm buying cash tomorrow, I'm losing my insurance, how much is it now? It's $10.99. If I present my free RX Cut card, it's $7.20, and I as a company made $2.50 that will provide a revenue share with what MSNBC said is the best get-rich-slow business opportunity in the country. And it's doing good and feeling good and doing right, because every time you hand that card to someone and they save money, sometimes it can be the difference between bread and butter on the table or not. Medications are very expensive. What people don't understand about medications is it works very similar to gas stations, which frustrate me. On my way here, in 1 mile, I saw one of the major gas stations' pricing increased 10 cents once I switched into a different township. Well, pharmacies operate the same way. So in the more impoverished area, medications are going to be the least expensive. And in that same major chain pharmacy in Manhattan, it's going to be a hell of a lot more, period. I mean, so someone needs to level that playing field, and with the RX Cut card, we do that. Because our discounts are deep, and we pass them along to our consumers. And it doesn't matter whether you're in Harlem, doesn't matter whether you're in Manhattan, doesn't matter whether you're in Poughkeepsie, the price for the medication is going to be the same, because our discounts are the same no matter where, because geography is irrelevant. I'm working off of a manufacturer wholesale pricing list, And we're passing through as high as 85, 90% savings in a lot of cases on medications. An up and growing market for us really is the pet medications. A lot of people don't realize you can get Snoopy's prescription filled at your local Acme Save-On or Target or Walmart pharmacies. The only thing you need to do is you need to ask your veterinarian for that medication. And for the non-human medications, we have an 800 number for the tick and flea and Frontline and HeartGuard. You can call, and oftentimes we're on average 10% below some of the commercially available, 1-800 and web-based fulfillment companies. And that's really what the thrust of the program was designed to do. Provide consumers a competitive edge with pharmacy to allow them to actually have an impact on their own fees that they spend at the pharmacy and know that they're not paying $1 more than they should.
Now, Jerry, I know the answer to this, but for the benefit of our newer agents, tons of discount cards out there today, hundreds. At last count, probably 300 plus. What separates our card from all the rest?
Well, there are a few things. Most every other program that we're with that I see requires some form of eligibility. They're going to want your name, phone number, cell phone number, some piece of information because they have something else that they're going to do with that data set. We've always come out with a blinded program, meaning that we never ask for anyone's name or any information. You can literally take that card and pass it to 20 people behind you at the same pharmacy. Everyone can use the same card because we have no agenda other than to save people money. There are, at the end of the day, probably 400 card programs out there, but at the end of the day, they funnel down into 6 players. I'm one of the 6. One of the only 6 that was picked by Google to be interfaced with the Google Health program when they had the Google Health portal. And we went through a significant amount of reverse due diligence with Google, and we have an award-winning search engine, and I challenge you to compare it to the rest, where it allows you to put in as many medications as you want, and in a New York second, it's going to return all the results, and you'll be able to easily identify, wow, I'm going to get these 3 medications here and these 2 over here. But you don't have to do it one at a time. It's always going to find cheapest medication by pharmacy, and typically it's never going to be the 3 big brand stores. It's usually going to be your Walmart, your Target, your local pharmacy, Acme Save-On, ShopRite, and so forth. Because they're not owned by a pharmacy benefit manager. It's against the better interest of the PBM and the pharmacy to say, well, on one hand, we're the pharmacy, we don't want to give this member the discount because the PBM wants that $9 that they were going to take out of my pocket on my ibuprofen. So stay away from those facilities and you'll find that you'll save a lot more money.
All right, that's our discount card, but there's a lot of buzz around here about our rebranded product, Get Benefit Relief. Let's talk about that a few minutes on how this thing's been retooled.
And I'm really excited about this, and I'll tell you why. Over the last year, in anticipation of healthcare reform, my mailbox has been flooded with competitors' discount prescription cards. And now it gets to the point where, should I use this one or this one or this one or this one? You get to the pharmacy and you really don't know which one you wanted to do. So I wanted to create a new way that we can rebrand, as well as solve a couple other critical problems that are occurring this year. As we all know, with healthcare reform, millions of people are now going to have access to physicians, which means millions more prescriptions are going to be issued. But more importantly, access to a physician is going to become harder and harder and harder, which is why you see all these corner urgent care facilities being cropped up that are staffed by nurse practitioners to solve the colds and the flus and the nicks and the scrapes. You're not gone there if you have a life-threatening situation, but you are gone there for 75% of the reasons, as opposed to going into the ER paying 3 times as much money. We have a better solution. We're providing 24/7 access to a physician for not only the cardholder, but his entire family, where they can call a physician and quickly have a situation resolved. You've got poison ivy, they can take a look at it right on your camera. Yep, that's poison ivy, we can prescribe it. Oh, I have a sinus infection, these are my symptoms, and I'm coughing. All right, we'll start with a Z-Pack and a cough suppressant, and we know if that doesn't work, I'm getting amoxicillin next. So there are certain protocols that can get followed, that can be easily diagnosed over the telephone. And obviously for the acute and severe conditions, you still need to consult your primary care physician and or go to the emergency room. To supplement that, we include a nurse hotline, which has over 1,200 topics that they can educate you on for the things that you perhaps are below a conversation you want to have with a doctor, but it's still a healthcare concern that you want to have answered. So you can talk to a certified nurse 24/7 on our toll-free hotline and ask away any questions that you have. With that, we've included a real cool product called Health Advocates. Health Advocates has been around for 13, 14 years now. Personal friends of mine formed that company. They were the former brain trust over at Aetna. But what they realized is it's getting harder and harder to navigate through the healthcare system with the referrals and the second surgical opinions and this procedure's not covered, or no, we're not going to allow you to have that bone marrow transplant until you have the following 3 things done, at which point it's too late anyway. You need someone in your corner that can fight back. And included in this program, we have an advocate, a trained, skilled nurse or physician or caseworker that's skilled to navigate through the nuances because they work at all the major carriers to get results, to get your situation resolved, to allow you to get on with your life and take the burden of the problem away from you. In addition to that, we have a medical bill saver. Unlike any of the others that are in the market that will charge you a percentage of the money they actually save, this is a straight pass-through because we're not that type of organization, as you know. We have our pharmacy card, our RxCut card, and we have our PET card. And because this is a paid benefit, that we're offering it at an unbelievably low price, so whether you're single or your family, you have the ability to pick up the phone. If you use it just twice a year, you're going to save a $50 or $100 copay to the doctor and 2.5 hours or 3 hours of your life. If you're on a salary, not a big deal, but if you're an hourly employee, all right, and you lose 2-3 hours for work sitting at a doctor's office, that's costing you an awful lot of money, more than the entire annual cost of this program itself. Now, if you have children, another great benefit. You know, how many times do you go into a pediatrician's office? And what do? You get around sicker people.
True.
Telemedicine's the future. Why we put all this together was to solve a huge need that now exists in this country for telemedicine, but more importantly, to marry our card, once again, to cement our card into the core of the benefit. Because psychologically now they're paying, as inexpensively it is, $12.95 a month, but I believe it's going to be our best source of distribution for the pharmacy card, because it's going to eliminate all the rest of the fog with the competitors' products. So you know what? This is a great program. I'm going to use this card, not any of these. So we had to rethink ourselves, and we spent a lot of time. We grew fast over the last 5 years. We took a breath over the last year and rebuilt our technology platform so we're ready to go to that next level. We reshaped our products. We reshaped our look and our feel and our brand and our website. We reshaped all of our technology, and I'm excited, really, to get this year launched. We've got an overwhelming reception on this product.
Jerry, I'm a new rep. I'm going to work real hard, but I want to work real smart. What other advice can you give our reps on how and where to spend their time in order to be successful in this business?
Well, we've built a couple models in the past, all of which have been successful, and we've learned through our sessions with our team members and our partners in business that the life cycle, just to start with a distributorship for pharmacy, honestly, it's about 5 months before you get your first check, just by the nature of it, because you're going to hand a card out today. On average, it's going to take 2 to 3 weeks for someone to use it. We don't bill to the 15th of the following month, and we have 62-day receivable, and then we pay 30 days after that. So you're going to be, depending upon when you start the program, somewhere between 5 and 6 months before you start seeing residual income on the pharmacy card. And we realize when you're building a business, people need to invest money in their business, so we need to figure out a way to give them money to invest. So we created really, part of the uniqueness of this program too, it's a 3-prong approach. One, you can get paid weekly immediately for distributors that you bring in. Okay, so then you can sit and eat and you can make money. So if you know you want to make X, okay, well it's going to require me to bring in 3 distributors this week. Those distributors immediately start bringing in distributors, which you get a piece of. But more importantly, we start moving this product out into the market, because this product gets paid in 30 days. So we're not waiting 6 months for it. So all of the premiums that we collected this month, you'll get paid on next month on all of the GBR benefits. We recommend marking that, although it's great for 1s and 2s, which was easy. We recommend marking this again to the masses, working into the larger employer groups of 50-person groups, of 15, 20, 30-person groups, working with agents and brokers and various venues to get this product out into distribution, because it's a quantity play. But it's going to give you 3 legs on the stool, which is now going to give a better balance, which is a much better rounded wheel in business. So I can't wait to see what MSNBC says about this one.
That's great. Well, listen, some great advice there to our new agents. Listen, I want to thank you for your time today. Thank you for your words. And you heard it from the man. There's passion and conviction in his voice. Take some of that energy and infuse it into your business efforts. Don't forget to complete your training in your back office, and we'll talk to you next time. Take care.